Hi there, my name's Allison Frey, and I'm the Director of Student Services at Towson University in Northeastern Maryland. Today I'm going to be discussing Step 3 of the Strategic Prevention Framework, planning. Strategic planning is important. It's going to take the guesswork out for us and ensure that efforts are appropriate, comprehensive, data-driven, and evidence-based. Really provides a roadmap for us so we have successful implementation. So us as prevention planners, we should consider three things. Number one, prioritizing the risk and protective factors associated with the substance misuse problems that have been identified. Step two, select appropriate programs and practices to address each priority factor, and then combine them to ensure a comprehensive approach. And then three, we're going to need to build a logic model and share it with our diverse stakeholders. Because the more people who understand the problem and are on board with the prevention plan, the more likely this approach will be sustained over time. So let's start with prioritizing risk and protective factors. We should consider prioritizing since it would be difficult to address all factors of substance misuse. Let's think about what are the key drivers and how important and changeable are they. It's best to prioritize risk and protective factors that are both important and changeable. So important means the factor contributes to the priority problem, that it's relevant to our work and our focus population. And it's not just isolated to our work. It may be associated with other harmful behavioral health problems. And then what about changeability? Can the community or focus population influence specific risks or protective factors? Maybe ask yourself this: do you have the resources and readiness to address this? Does some program or practice already exist to address this? And I think most importantly, can we get it done within the time frame? Next is selecting appropriate programs and practices. How do you know if they're appropriate? You have to consider if it's a good fit conceptually and practically for the community or focus population. And can the program or practice effectively address the priority substance misuse problem? Evidence-based programs and practices have documented their effectiveness, so whenever possible, select those for the best outcomes. Now, how do you ensure a comprehensive approach to this work? Your programs and practices should combine to reach different levels of risk, target multiple social contexts, and ensure cultural relevance. As an exercise, think of the social cultural model. It's a theoretical framework that emphasizes the influence of society and culture on individuals' thoughts, behaviors, and development. It really helps us understand how social and cultural factors are shaping human experience. So staying culturally relevant is critical. It's helpful to involve diverse community members, key leaders, conduct focus groups to map the cultural landscape, and analyze group data, qualitative feedback on potential interventions. A logic model can be your roadmap to plan where the efforts are headed and how goals can be reached. The model explains why a program or practice will succeed, and it can also expose those gaps, allow for corrections, especially if you're feeling like you're off track. And it makes evaluation and reporting much easier. Most logic models include four components: problems and related behaviors, risk and protective factors, programs and practices, and finally those outcomes. Outcomes are usually broken into short and long term. Looking at those immediate effects can be built upon with the longer extended changes. The logic model will assist you with sharing what is hoped to be accomplished and the role you want partners, whether they've been invested already or are new to your work, to take. So let's recap. As a prevention planner, you should prioritize important and changeable risk and protective factors, select appropriate comprehensive programs and practices, build that logic model or roadmap for your work, and share it with as many folks in the community as you can. Thanks for listening, and best of luck with your prevention planning.